Hello. Today we are gonna discuss about Chang's Dental Clinic case in our presentation. So first of all, introduction. So in this case, the main role was with the Chris Miller, who is currently working as a dental associate. He is very extremely personable and maintains a pleasant demeanor and a lot of experience in performing the dental work. He has a lot of experience uh, in doing the dental work, and he doesn't have any experience running a business, although he did have some limited business training courses in the school, but it was not sufficient for him to run a business at the starting. So let's discuss about the Chang Dental Clinic. Actually, this clinic was a small practice clinic where there was only one dentist and assistant and the clerical staff, which used to be open from Monday to Thursday in a weekdays. And at present, the asking price is $510,000, and in which the equipment would be $141,000, and the lease improvements would be $65,000, and the office and supplies inventory, which involves around $88,000, and the goodwill which he has been getting from the previous owner would be around $296,000. So this was about the Chang Dental Clinic. So let us know about the dental industry in the Ontario. So most of the dental clinics and the dental industry in the Ontario were having the fixed prices. So there won't be any loss or something which could affect his new startup, and the number of practicing dentists were not technically regulated in this area, and it was mostly a self-regulated regarding the location of new clinics. If a new practice does not open unless there is a clear need. So in this case, Chang's Dental Clinic was already in Ontario, and it was already having roots into that area. So most of the practitioners have a specialty area and refer client as necessary. And in and around Ontario, there were 3 dental clinics in Petrolia, and around 45 to 50 dental clinics in Sarnia, which was around 15 to 20 minutes away from Petrolia, and 270 clinics in London, which the place which is around 45 to 1 hour away from the Petrolia place. So there is a very good opportunity to grow for Chris Miller. So this was the introduction. I'm handing it over to Madhu.
Thank you, Vishal. Coming to the problem identification, the main problems in this we can see as the financial budget, issue regarding the financial budget, and concern about the patient flow and loan from the bank. Next slide, please. So next comes the SWOT analysis. First, we have strengths. So Miller's experience in dental practice. We know that Miller worked as an associate for 3 different dental practices, and the strong client base associated with the dental practice, patients' loyalty towards the dental practice center. We can see patients had strong positive connection with the practice. And next is the Miller's nature, extremely personable and interactive with patients. As we can see in the case, Miller maintained pleasant attitude and interacted with patients as much as possible, and patients indicated a high level of satisfaction with Chang's dentistry skills. Moving to the weakness, uh, though Miller worked as a associate for 3 different dental practices and he had dental practice experience, Miller lacked experience in running own a business, and Miller had large student loan to be repaid, which and also the practice required more funding and limited workforce. Opportunities include financial growth, recognition in the community, increase in patient flow to the dental practice, Employment opportunity for local people. Threats include many dental clinics are in and around Petrolia, and most dental treatments are not covered by the government. And further will be continued by my colleague.
So for the calculation, these are the assumptions that we made. First, the dental supply costs and laboratory fees will remain the same. Second, reduction of associated fee by 15%. And third one is no bad debts or recoveries for fiscal year 2006. So let's move on to the calculation. So this is what we found in our calculation, where the total revenue will be 957,000, and associated fee will be 141,000, and also dental supplies will be 206 21,626, and laboratories fees will be 62,715. So total expenses for 2006 would be 527,217, and net income from the clinic will be 429,784. Net income will be more than that of 2005. That is 264,408, and 2006 it's 429,784. So we have a few more data that we found from our calculations. Can you move on to next slide, please? So for the projected net income for 2007, it would be 393,921, and for 2005, it's 264,408. Similarly, total liabilities for 2005 is 10,929, whereas we found out for 2007 it will be 298,614. Talking about total current asset for 2005, it was 59,000, whereas for 2007, 261,135. Also for ratio analysis, 35% operating expenses. 30, ratio analysis for 35% operating expenses is 32.7%, and net income is 41.4%. Moving on to next slide, I would like to pass on to Smriti.
So thank you, Risika. Going with the alternatives, first one is either to take the financial help from bank or not. Either he can go with the partnerships, or he can ask help from chance for certain time till the period of its transition. Next slide, please. Next slide, please, Vishal. So after the with the from those alternatives, we came up with the recommendation. Our recommendation consists of both the benefits and risks. Like in benefits, it's like the business, dental business at that current state in that Petrolia it is easy to run for the moment, because there are only three other two other competitors, and it is if he up to buy the clinic, he is he will be self-employed. That is, he doesn't have to depend upon other people, as well as he have similar already experience, as well as he has a client base, as they are familiar with his working technique, which is one of the most important benefit, or one of the most important factor that can help him grow in his business. Another is like he as a patient are already following him, he has an area to improve, so that he can attract more patient, as well as he can grow in the business. And going with the risk, uh, there might be some of the risk, like chemistry between existing employee with the new management, are like either the new management will be familiar with the employees work environment demand, or how the way they work, as well as patient might have some doubt, as they are frequently changing the business. Before Chang, it was one person which he Chang was, now he's now it's Miller up to by patient might lose their reliability on the clinic for that moment. As well as Tang has only the experience of working as an assistant. He has never worked as a businessman for a dental practice. As well as he will he will have a more opportunity. So that is uh, uh, I'm so sorry. He will have more responsibility to run a business. He will have more burden to run a business and make it successful. And there is a huge amount of money engraved on it to have a loss on the business. As well as he should always be aware about his competitor. There is always a competitor, as the area is growing, there is more chance of other people opening the new clinic in the same area, as there is only three for at that moment. So these are the risks. Further will be continued by Mamnu.
Okay, thank you, Smriti. So in case of implementation plan, we can see Miller can reduce 15% of the associate fees in projected 2006 revenues from 166,000 to 141,000. As he has the experience of doing the associate, so most of the done work if he do, so he can decrease this 15% of the associate fees. Avoiding any bad debts or recoveries for fiscal 2006 also should be an implementation plan to go for, and convincing the loan manager for $320,000 for financing to operate his running business, and he should cut the personal expenses and put that towards the loan. So whatever way he can put the money to complete his loan, he should be focusing on that, and deduct the goodwill of the company and also other expenses required for the acquisition of the current business. So next slide. So now we are having the question that to buy or not to buy. Should Miller buy the Chang Dental? So from Miller's perspective, he wants to buy the current business, and from the overall scenarios, yes, Miller should buy the Chang Dental because this business is a growing field and it would be a great opportunity for Miller to contribute to his own practice. And since the need of creating a new practice is scarce, he may not get another opportunity to buy an existing high demand practice like the Chang Dental already has the reputation. He should not make any changes to the proposed loan, and also like 10 years there is a loan of 6% interest. He should not make any kind of change on that issue. And the bank should also approve the loan because it's a proven low risk, high return investment that has a loyal customer base. As it's a current business, so there is more opportunity that the loan can be refunded to the bank itself. So there is more possibilities that the bank will give him the approved loan. So that's all from us. Thank you very much.